Hi everyone. In this video we will be discussing all the things about the tongue. Basically its parts, its development, its nerve supply and its lymphatic drainage and the muscle supply. So first discussing the structure of the tongue. Structure of the tongue is such that it is divided into two parts by a V-shaped sulcus that is called sulcus terminalis. Anterior part is also known as oral part or pre-sulcal part, and posterior part is known as pharyngeal or post-sulcal part. Then oral part. Oral part, first we will be discussing about the development. Okay, oral part or presulcal part. This originates from the lingual swellings of the mandibular arch, that is first arch and the tuberculum impar. And this develops from the hypobrachial eminence. Hypobrachial eminence, that is composed of third and the fourth arch. So first arch and third and the fourth arch. Then what all papillae are there on the interior part? On the interior part we have the foliate papillae. These one on the sides are the foliate papillae, and before the sulcus we have the circumvallate papillae, and interspersed all over the part presulcal part is filiform papillae. So three types of papillae are there: foliate, circumvallate and filiform and fungiform papillae. Then in the part posterior, we have the lingual tonsils. That is, the lingual tonsils are there, lymphoid follicles are there. Then we have the muscles. Muscles in the anterior and the posterior part, and how they are developed. In the muscles, basically we have the in the muscle supply we have the palatoglossus muscle and the other intrinsic muscle. Palatoglossus. The palatoglossus is supplied by the 10th nerve, and the palatoglossus is originating from which arch? Sixth brachial arch. And the other muscles are originating from the occipital myotomes. And they are supplied by the hypoglossal nerve, that is 12th nerve. So arches related to the development were 1 in the anterior part and the 3 and 4 in the posterior part. And arches related to the muscle are 6th arch. 6th arch, and the nerves related are vagus nerve and the hypoglossal nerve. 6th arch and 10th and the 12th nerve. And which muscle is the safety muscle? Safety muscle is the genioglossus. Genius muscle, safety muscle. Okay. Then next we have the nerve supply. Nerve supply of the tongue. We have done with the motor supply. Now we need to know the sensory supply and the general sensory supply and the taste sensation. So how we'll remember that? See, anterior two-third sensations except the velate papillae are carried by the general sensations are carried by the lingual nerve. Okay, and general sensation by the lingual nerve and the special sensation by the chorda tympani. Lingual nerve is branch of 5th nerve and the chorda tympani is branch of 7th nerve. Then the posterior 1/3 including the velate papillae. These are supplied by the 9th nerve. Sensory and taste both are supplied by the 9th, that is glossopharyngeal, and the posterior most part or the valleculae. These are supplied by the internal laryngeal nerve. Internal laryngeal nerve is a branch of superficial laryngeal, further branch of vagus nerve. So what are the branches linked with the general supply? 5, 9, 10, and with the taste sensation 7, 9, 10. 5, 9, 10, 7, 9, 10, and with the motor supply 10 and 12. Then next we come to the lymphatic drainage. In the lymphatic drainage, tip of the tongue is drained by the submental lymph nodes, anterior 2/3 by the submandibular, and the posterior 1/3 by the jugulo-omohyoid. So done with the development. with the lymphatic drainage and with the nerve supply, motor supply, sensory supply, and taste sensation. These are the things which we need to remember, we need to revise again and again. And if any question comes out of the tongue, it will be from this topic only. I hope you will like it. Please do subscribe my channel if you find my content useful. Thank you.